Hi, ACR Convergence. I'm Dr. Rachel Tate coming to you from my home in West Palm Beach, Florida. I am honored today to be interviewing Dr. Irene Blanco, Professor of Medicine and Associate Dean of Diversity Enhancement at Albert Einstein College of Medicine, Montefiore Medical Center in the Bronx. Thank you so much for being here, Dr. Blanco. I really appreciate it.
No, thanks for having me.
Of course. Well, it's been such a busy ACR, and I wanted to touch on something that it's near and dear to your heart. And obviously, diversity and inclusion issues really pepper the landscape, I think, in medicine, and especially right now. And you've done some wonderful work regarding these issues, predominantly in rheumatology. Can you share with us some of your findings?
Sure. My focus in rheumatology is predominantly on education and how we can start to think about addressing these issues through our fellowship curricula. It's my point of view that this is literally the last time that we have our trainees in a training setting where they can be in a safe space to really think about and investigate and talk about these issues, right? And it's also a place where we can correct anything that we see before we have to kind of depend on them to look for the CME in order to address these issues, right? And so, I presented 2 ACRs back and then last ACR. So we've done a couple of needs assessments. So the first one was a needs assessment of the fellows, right? So like, what are they seeing in terms of this landscape? What are they talking about in their fellowship programs, et cetera? And we did it as a qualitative survey because sometimes better said, qualitative interviews, because these issues can be delicate, can be really hard to address. And oftentimes the complexity of the issue isn't grasped sufficiently in a survey, right? So to really get to the meat of the matter, we did these focus groups. And it's funny because, I do a lot of sort of iterative stuff in qualitative medicine, in qualitative interviewing, and we could have probably stopped at the first interview because they were so similar one after the other. So number one, the fellows are seeing issues of disparate care. Poor patients are not getting the care that they need. Black and brown patients are not getting the care that they need. Access is a huge issue. But other than them sort of talking about it and trying to grapple with it by discussing amongst themselves, there's not really a formal structure through their programs to address these issues, right? So program directors are not talking about it. And rarely, but on occasion, they're seeing their faculty not be ideal role models, right? So it leaves them with the sense of, well, how do I address this? They're powerless. But at the same time, because of that like hidden curriculum and by, as a faculty member, the things that we leave unsaid, a lot of them start to think, well, is this rheumatology, right? Like these social aspects of medicine, like, if you were to put this, and I'm paraphrasing a quote, like, if you were to put this in the curriculum, what would you take out? So there's not a sense of, well, if I really want to take good care of my lupus patients, I need to address their psychosocial needs in addition to their pure biochemical, pathological, pathophysiological needs, right?
Yeah.
And so it's this disjointedness of, well, if I address their poverty and their access and all this stuff, I don't have time to think about rheumatology. I'm like, no, the two have to come together. And so then last year we presented the needs assessment from the program directors. And, the program directors are saying very similarly the same things, right? That they don't have much of this content in the curriculum. They don't know how to teach the curriculum necessarily themselves. They don't have faculty that know how to assess the curricula. So they need resources, right? They're like, I need resources. Help me figure out how to teach this to my fellows so that we can all move the needle, right? And actually address a lot of the issues that our patients have. And so that's sort of in the midst of where we are right now, thinking, okay, we're going to need probably a 1.0 and a 2.0 kind of curriculum, because it seems like we really need to train the trainers to a certain extent, right? On how to have these courageous conversations, because potentially there's going to be some introspection on the programs, right? So like once we start to talk about this landscape, then we start to look at our own individual programs and saying, well, are we doing enough, right? And people have to have the courage to have that conversation.
Well, and I'm sure you've done beta testing even in your own institution. I mean, that's the importance of education.
Hands
So,
down.
and I know that you kind of touched on this a little bit, but kind of where do you think the rheumatologist's role in and outside of academia really is?
I mean, I think that when we talk about, for example, health disparities and access issues, I think we have so much data, right? We have a lot of data in terms of RA, OA, lupus. Even if you look at a lot of the abstracts that were presented this week, right? Dr. Goodman presented that Black and brown patients are not getting arthroplasty at the same rates. Potentially, racial and ethnic minorities are not faring as well. There was a great abstract on providers not feeling comfortable assessing lupus rashes and skin of color, right? So we really need to think about, what are we teaching our fellows? How do we open up access for our patients? How do we bring the two together, right? How do we create those resources? And I mean, it's hard. It's hard. I think there are lots of conditions where the disparities are very well described in and out of rheumatology. But
So
it's to the individual practitioners in that specialty to really address those issues, right? Like, I can't leave it to primary care to talk about lack of access to transplant, for example, right? For Black and brown patients. I can't leave it to primary care to be the only ones to think about my patients not getting knee replacements. I can't leave it to primary care to think about, lupus patients not doing as well as they should be doing, right? Like, we have to take the onus of our disparities and therefore really start to think about what are we going to implement, right? What are our interventions?
I mean, advocacy is so important. I
Environment.
think that's something that we at Room Now feel really strongly about, as well as the rest of the community. So I really thank you for honing in on that. Um, we have just a little bit of time left, and I wanted to ask you more about the hub. Can you tell us a little bit about what's new from the ACR Equity and Inclusion Hub this year, or
So
that it's new this year?
well, it's brand new. I mean, the hubs in general have really expanded, and it was a way to really get other sections of the community that would normally find each other right at the exhibit hall, typically meet me by booth 6, right? Like, that now it was just to find these meeting spaces, glorified breakout rooms, if you will. And this year is the first year that we have an equity and inclusion hub, which was fantastic. We were able to have a D&I town hall where we could just listen to members, right? And convergence attendees to what are their thoughts in this space? What do they want to see happen? We had a great debrief on one of our speakers, Dr. Mark Neve, on implicit bias. He's an incredible speaker and a huge resource. So I think for the people that were able to speak with him in the hub, that was a really enriching experience. But at the same time, we were able to post a lot of resources. So for people that are really interested in thinking about how to move the needle in terms of D&I initiatives for their programs, for their residencies, for their divisions, there's tons of resources there, things to educate yourself, things to use to look at your own curricula and the content that you're teaching, and ideas on how we can better assess our trainees, how we can write more equitable, right, letters of recommendation and letters of support for people to make sure that we're not necessarily using gendered language, et cetera. So there's a huge span of resources that I think Dr. Blazer and I are really, really proud of. And I'm hoping that people will make use of them as they move into these spaces.
Absolutely. And these, just for clarification, I know I can download them now. I'm hoping they'll be available after the conference as well.
I believe so. I believe the hubs are going to stay up for a while longer. And so, if you can't download them today, ideally within the next few weeks, they should still be up.
Okay. Oh my goodness. Thank you so much. I really appreciate you taking the time out of your busy day, your busy schedule. I know what it's like to be working remotely and being at home and listening to ACR as well. So I really thank you so much. And for more news, be sure to go to rheumnow.com and please follow me on Twitter at UpToTate. Thank you so much.
Thank you.